Hello, this is Danny Blyth looking at sleep in traditional Chinese medicine, adults and children. Remember, this is for acupuncture students and practitioners only. Please pause and read this. Insomnia has lots of causes in adults, but broadly speaking, the Shen can be disturbed by heat or fire. It can be not rooted in yin and blood. This can be because of deficiency or because of shock. And it can become obstructed by blood stagnation, qi stagnation, food stagnation, or it can be disturbed by something else. So if we look at the Shen or the Hun and the Zhe being disturbed by heat and fire, we get disturbed light sleep, frequent dreaming, nightmares, agitation, and slightly manic. If there's heart fire, there can be anxiety involved, which can make it difficult to get off to sleep. And we might get other signs of heart fire, mouth and tongue ulcers, bitter taste, feeling hot, red face, mania. With liver qi stagnation creating heat, we get waking up at 2 to 4 in the morning. Worse with stress, teeth grinding, and sleep is light. We might also get PMS and worsening of the insomnia with period arriving, depression, mood swings, irritability. With liver fire, the insomnia is severe, nightmares and waking early, so the liver qi stagnation has kind of exploded and turned into fire. We might see other symptoms. The anger might become rage, and there might be severe headaches. With stomach fire, you might get waking up in order to eat or drink, and you might have associated symptoms like bad breath, hunger, acne, and frontal headaches. With phlegm fire or phlegm heat, there can be snoring. You might have general phlegm symptoms like a tight chest, nausea, dizziness, and if it's phlegm fire, you might get more severe Dian Quang symptoms. With food stagnation, which is accumulation disorder in children, the insomnia is definitely related to indigestion and to overeating, and you get symptoms like gurgling, fullness, bloating, belching, nausea and vomiting. It can be acute and it can be chronic. Finally, residual heat in the diaphragm is what gets left over if you have a lingering pathogenic factor or heat in the diaphragm insomnia that you get during a flu. So the Shen not being rooted can be yin and blood deficiency. If it's blood deficiency of the heart, we get difficulty getting off to sleep, light sleep with frequent waking. Systemic signs like being easily startled, poor memory, choppy pulse. If there's spleen qi shu and heart blood shu, can also get panic attacks, phobias, circular thoughts and overthinking. If it's more liver blood deficiency, you get restless sleep, vivid dreams and a floating sensation getting off to sleep, so the Hun becomes affected. Might also be depression, lack of direction, weak nails, light periods, dry skin. If there's yin deficiency of the heart and kidneys, or the heart and kidneys not harmonised, you can get zhangzhao, which is restless organ syndrome or visceral agitation syndrome. And like with spleen, qi and heart blood deficiency, you can get symptoms like fear, anxiety, insomnia, palpitations, phobias, waking hot and bothered, and waking in a panic. This can be chronic, or it can come from prolonged fever, but it can also be much more acute and come from shock. We get these same symptoms manifesting as heart and kidney yin deficiency with 5-palm heat, night sweats. With liver yin deficiency, you get the typical yin deficiency signs along with restless sleep, waking early, vivid dreams or excessive dreams, and dreams that are very visual and very much seen, nightmares, sleepwalking or sleep talking. The Hun and the Shen are out of balance, and there might be systemic signs like irritability, teeth grinding, dry sore eyes. Finally, heart and gallbladder qi deficiency, you get waking early, light sleep, waking in a panic, anxiety, easily startled, emotionally very up and down, timidity and lack of assertion. So a deficient wood and a deficient fire. If the Shen's obstructed by blood stagnation, you can get disturbed light sleep, restless sleep, dreams, severe anxiety, poor memory, abnormal behaviour, dementia, mania. We've already discussed how food stagnation and chi stagnation can also cause insomnia. Finally, the Shen might be disturbed by something else. So the insomnia is secondary to pain, getting up for the toilet, breathing difficulty, itching, snoring, drug use, medication side effect, shift work. Might be habitual, somebody getting up to look after an ill child or parent. So that's a very brief introduction to insomnia in adults.